Welcome back, folks. We are so lucky to have a partnership with the Wellness Company and its extraordinary Chief Scientific Officer, Dr. Peter McCullough. He has had so much right about the last 5 years, and he continues to push this country to get to the right spot on public health, and we're lucky to be joined by him again. Doctor, welcome back to the show.
Thank you.
So I want to talk about some new scientific research that's been coming out. The more we learn about people who took more and more COVID-19 vaccines, the more we realize they probably have harmed themselves, not helped themselves. Tell us what the new science shows.
Never have we had a vaccine where you just keep taking it over and over again, the genetic code for the spike protein. And the great concern is the body would get fatigued and just constantly getting these shots. And indeed, a paper by Perez and colleagues have shown that the body essentially gets tired of seeing this spike protein, and it switches from useful IgG1 and IgG2 classes of antibodies to useless IgG4 antibodies that actually weaken the immune system. And sure enough, people who took 5 shots, they were getting more recurrent COVID than people who took fewer shots. So the vaccines, as they're in their iteration of the 6th, 7th, and 8th boosters, it looks like they're counterproductive.
Oh, it's such a shame to hear, because people should be able to trust their doctors. If there is someone who's watching who has gotten 3, 4, 5, 6, however many shots, and they decide I'm done, is there a way for them to detox, or should they just kind of let their bodies reorganize and rehabilitate on its own?
Important point. It doesn't look like the body gets rid of the spike protein on its own. You know, today in the office, I had a patient who still had measurable spike protein, according to the InCell DX assay, 22 months after his booster.
Wow.
So listen, that's a long time to have spike protein in the blood. That patient has had a blood clot. He's had heart damage. It's clear the spike protein is dangerous to some. So we recommend what's called base spike protein detoxification. Wellness Company has the lead product. That's called the Ultimate Spike Detox. 2 capsules twice a day, can be advanced to 4 twice a day. Make sure under doctor's observation, with the caveats that there can be bleeding, particularly in conjunction with blood thinners, although we use the 2 together. But patients need spike detoxification, in my opinion, for at least a year, and then reassess.
Wow, that is a big deal. For the first time in a very long time, we have fresh blood atop the public health agencies in America. Dr. Jay Bhattacharya taking over, being confirmed. What are some of the first few steps that he and other new leaders should take to get confidence back in the public health system?
Well, National Institutes of Health needs a check on conflict of interest. People are greatly concerned that researchers within the NIH are getting royalties from vaccines that are produced. And so it tends to, work towards biasing research. People have said, well, why were we fooled on the research on COVID vaccines? Well, the NIH was behind a lot of it. And if people have a financial conflict of interest, they're likely to become, in a sense, unreliable as independent researchers. So we need a check on conflict of interest. We need the National Institutes of Health, and it's been proposed that they kind of drop the COVID research as we conclude the pandemic, and probably focus on spike protein disorders emerging after the pandemic in conjunction with the vaccines.
And another one of those health agencies, the CDC, has a new nominee, Susan Menarez. What are your thoughts on her?
Well, she's a PhD molecular biologist, and I've had a chance to interact with her. She's quiet. She's going to be much different than Walensky or Cohen. And, she's, strongly endorsed by Trump and RFK, and I think they're on the right track.
Good. That's good news. So I want to talk a little bit about the 3 diseases that are getting the most headlines today: bird flu, measles, and drug-resistant tuberculosis. Can you give us your latest update on where all 3 of those are trending?
Well, in terms of bird flu, we've had the emergence of the D1.1 variant. Still greatly concerned that this could cause serious cases. All the farm workers now can get a free kit that gives the proper nasal spray and throat sprays, as well as emergency treatment from the wellness companies, called the Prevent and Protect program. Please go to our website, twc.health. Get your free kit if you're a farmer. Have to show your poultry licenses and other information, but it's important, protect the workers. In terms of measles, We've had more cases in more states, and we're going to have probably about an average year in measles cases. A high number would be about 1,200 cases in a year. I believe we're just under 400 right now. One confirmed death. It looks like she was undertreated. This poor girl didn't get proper treatment on day 3 when they saw a doctor. Should have gotten antibiotics, nebulizers. She could have been saved. Remember, people should not die of measles. It's a mild illness. And then lastly, the drug-resistant TB. This is a concern. This is a concern largely of homeless individuals and migrants. Their TB testing, we now have a blood test for it, or the skin test, and then early multi-drug treatment.
So important. Sir, you have been such an innovator, whether it's getting those free kits out to our farmers on the front lines of our food supply chain, or getting all of us better prepared so we don't wait to crisis to hit our homes. Tell us a little bit about the wellness company's great medical kits, emergency medical kits that get us ready before crisis strikes.
You know, the big base kit, a lot of people ought to consider. That has everything in it. That's the tan kind of hard shell case. This is the array of more carry-friendly cases, the aqua blue home treatment kit, the black contagion kit, the red emergency kit, and then the forest green travel kit. But these are pre-prescribed medications, guidebook, access to telemedicine. This allows people to handle problems at home and avoid the emergency room or urgent care. Today I had a patient with a urinary tract infection. Good thing I saw her so I could treat her. But if she had a kit, she could have handled it herself and snuffed out the infection at a much earlier stage.
So important. You've returned medicine back to the patient-doctor relationship and given us a chance. You've really revolutionized telemarketing, or telehealth for all of us, and we're so grateful for that, sir. All the things you do. Thanks for joining us today.